is Dr. Shahryar, and today I'm going to talk about diabetes mellitus. If you don't have diabetes, you would still want to listen to make sure you don't have the risk factors to develop diabetes in the future. And maybe you can help a relative or a friend if they have it. If you have diabetes, then definitely you'd want to listen to what I have to say. In this video, I'll explain diabetes in simple words and identify the necessary precautions you can take to protect yourself from developing diabetes in the future. Before I proceed, please subscribe to this channel so that you are alerted every time a new health video is uploaded. In the last few minutes of this video, I'll talk a bit about how someone can grow as an individual and improve self-esteem, which will help you in your daily life as well. So let's talk about diabetes. Diabetes are of two types, type 1 and type 2. In this video, we'll talk mostly about type 2 diabetes. Type 2 diabetes is a disorder in which the body is unable to use sugar properly. As a result, the sugar levels in the blood increase above normal range. Human body is made up of millions of cells. Cells are like building blocks. All the cells or the building blocks in your body need sugar to work normally. It is their energy source. Sugar gets into the cells with the help of a hormone called insulin. Insulin is like a helper that opens the door for sugar to get in. If there's not enough insulin, or if the body stops responding to insulin, sugar builds up in the blood. This is what happens to people with diabetes. There's a lot of sugar in the blood, but the cells cannot use it. Buildup of sugar is known as glucose, harms the body in long term. There are two different types of diabetes, like I mentioned earlier. In type 1 diabetes, the problem is that the body makes little or no insulin. In type 2 diabetes, the problem is the body's cells do not respond to insulin, or the body does not make enough insulin. It could be either or both. So what are the symptoms for type 2 diabetes? Type 2 diabetes usually causes no symptoms. When symptoms do occur, they include need to urinate frequently, intense thirst, blurry vision. You might think and say that if diabetes usually causes no symptoms, then why worry about it? If diabetes is not treated, it can lead to heart attacks, strokes, kidney disease, vision problems, or even blindness, pain or loss of feeling in hands and feet, the need to have fingers, toes, or other body parts amputated. Compared to with people who don't have diabetes, people who do have diabetes are 2 to 3 times more likely to have heart attacks or a stroke. People with diabetes also have heart attacks at a younger age and that are more severe and more deadly. Plus, people with diabetes are much more likely to get kidney disease. Next question one can ask is, how do I know if one has type 2 diabetes? Your doctor will check your blood sugars and can let you know. According to the American Diabetes Association, there are 3 criteria to diagnose if you have diabetes, and either of the 3 can be used. I'll tell you the 2 easy ones to remember. One of the criteria is after 8 hours of fasting, no eating or drinking fluids. If your blood sugar is equal to or greater than 126, you have diabetes. Or the other criteria is one can get a test done known as hemoglobin A1C. If hemoglobin A1C is greater or equal to 6.5, that person is diagnosed to have diabetes. For this test, you don't need to fast. You can ask your doctor to do the blood test for diabetes that needs no fasting. So how do we treat type 2 diabetes? Most need medications once diagnosed. However, many can achieve better control of diabetes with making changes in their daily life. I'll talk about these changes later in the video. First, let me talk about medications that help control blood sugars. For treatment, We doctors usually start with pills or oral medication. Your doctor might gradually increase the dose till the blood sugars are controlled. Sometimes a second pill might be added to achieve better control. If pills don't work, then a person might be put on insulin injections. Your blood sugar will also need to be checked, and frequency will depend upon whether you take pills or insulin. If your blood sugars are very high, 200 or higher, your doctor will likely put you on insulin injections directly. Otherwise, he'll use pills. So, what is insulin? Insulin is a medication that lowers a person's blood sugar level. People who use insulin might use it as a second medicine or as their only medication. It usually comes in a form of an injection that people give themselves. If your doctor prescribes you insulin, he or she will also tell you which type of insulin to use. There are different types of insulin. Some types work faster, others last longer than others. How much insulin to use, when to use it, when to check your blood sugar levels. An insulin dose often needs to change when a person gets sick, has surgery, travel dose during these times. Since type 2 diabetes also causes other complications, one needs to take other medications to prevent such complications. For instance, medicines used to lower blood pressure can reduce chances of heart attack or stroke. Let me repeat here that you'll not only take medications to lower your blood sugar, but you may also need medications to control blood pressure if it's high and pills to control cholesterol if it is high, as both high blood pressure and cholesterol can further create complications and hurt your body. However, your need for higher doses of medication can be decreased, or some might not even need medications at all if they become more active and do activities like walking, gardening, or something similar for 30 minutes or more on most days of the week. They start losing weight. Being overweight increases the risk of many health problems. Eating right. Add fruits, vegetables, whole grains, and low-fat dairy products. Limit the amount of meat and fried or fatty foods that you eat. You have to watch and limit not only the kind of food you eat, but also the quantity. Eating large quantities of healthy food can also be harmful. Avoid alcohol. Alcohol can increase blood sugar and blood pressure. Quit smoking. Smoking increases the chance that you'll have a heart attack, stroke, or develop cancer. When you do all this, you have to watch out for something very important, which I'll talk about later in this video. All these measures of being active, losing weight, eating right will help control your blood sugars and diabetes better. No medication will be effective unless changes in your diet and eating habits are made and followed. If you keep eating food that has lots of sugar, carbohydrates in it, blood sugar control won't be achieved with medications. It's like trying to dry your hair in the rain. As long as water keeps falling on your hair won't dry. Dietary restrictions does not mean no sugar. It means less sugar, which will be different for everyone and will be decided by your doctor. Like I mentioned earlier, if diabetes is not controlled, it can lead to further complications like heart attacks, stroke, kidney disease, vision problems, including blindness. I'm not trying to scare you, but telling you what thousands of people around the world suffer because no one explains to them in detail how important it is to treat diabetes. It is also important to get a flu shot vaccine every year. Some people also need a vaccine to prevent pneumonia. Next question you might ask is, how do I know if my treatment is working? Your doctor can do a blood test called hemoglobin A1C. This test checks what your blood sugar levels have been over past 2 to 3 months. This test lets you know if you are doing a good job controlling your diabetes. Another way to know if your treatment is working is to check your blood sugar level yourself. Many people with type 2 diabetes do not need to do this, but some do. It involves using a device called blood glucose monitor. If your doctor recommends doing this, he or she will explain how and when to use this device. Goals to achieve during diabetes management are hemoglobin A1C level below 7%, blood pressure below 140/90 or below 130. Doctor tells you you are losing proteins in your urine because diabetes is hurting your kidneys. Cholesterol LDL level below 100. LDL is one of the types of cholesterol often called the bad cholesterol. Also, I'll mention here that if you go to your doctor, please have him check your urine, as one of the signs of diabetes hurting your kidneys would be protein loss in the urine. If that is happening, your doctor might start you on a medication known as ACE inhibitor or ARB. Talk to your doctor about this if you have protein loss. Very important thing you all have to be aware of in diabetes is how to recognize your blood sugars are actually low. I know we have been talking about high blood sugars since that's what diabetes is all about. But sometimes when you go on medications, or if you start eating right, start exercising, there is a chance your blood sugar might drop too low. How to recognize low blood sugars? One might start sweating and shaking, feeling hungry, feeling worried. Low blood sugars should be treated quickly because it can cause you to pass out. Always keep something sweet with you, like a candy or a chocolate, and eat it if you have such symptoms. Also, do check your blood sugars at times to confirm low blood sugar, and also inform your doctor. Can diabetes be prevented? Yes, it can. To reduce your chances of getting type 2 diabetes, the most important thing you can do is control your weight. If you already have the disorder, the losing weight can improve your health and blood sugar control. Being active also helps prevent or control the disorder. In summary, diabetes is a very bad and very harmful disease unless it is controlled. It increases the risk of heart attacks, stroke, kidney disease, blindness, and can lead to amputation of toes, feet, and more. It is very, very, very important that you change your behavior from now, even if you don't have diabetes but have the risk factors. If you do have diabetes, then definitely change your lifestyle and behavior, which includes eating healthy, losing weight, staying active, and exercising. Cutting back on alcohol and stopping it completely. Stop smoking. Sometimes these interventions are not enough and you need medications. Please take these medications regularly that your doctor tells you to. Medications work best only when you continue with the above mentioned changes in your lifestyle and behavior. Goals to aim for if you have diabetes. Hemoglobin A1C level should be below 7%. It is a lab test that your doctor can easily order. Blood pressure is below 140/90 or lower. LDL cholesterol below 100. Now I want to take 2 minutes and talk about how to improve yourself as a person. Going forward, all my videos in the end will have words of wisdom to help us be better individuals. Best way to change the world is to change yourself first. The quote I'm going to use and talk about is, "The tongue is like a lion. If you let it loose, it'll hurt someone." If people are not careful of what they say, their words can result in a lot of pain and suffering for others and can create problems for themselves as well. We should always weigh our words before we speak. Sometimes it's better to stay quiet and not respond immediately if someone is mean to you. Reply the next day if you have to, with a cool head. Thank you for watching this video. Hope what I have said helps you live a healthy life. Stay healthy and safe. Take care and bye-bye.
If you liked the video, please subscribe, like and share.